All right, we're ready to go. Now, I do have student from another class here. So I'm gonna put up 2 access codes. I'm only gonna say the access code to this class. So if you're from my earlier class, look in the chat box, okay?
Okay, I got a question. Is
Sure.
this 204 or 206?
We are 204.
Okay.
204, pediatrics, yes. Is everybody downloaded and ready? Okay, a couple things before we start. Once I put you all on mute, I don't want anybody to be talking. If you have an access code or you need administrative help, put it in the chat box. If it says universal code needed, give me the number it gave you and I will send you back your new code, okay? I can do everything through the chat box. Now, I'm gonna turn my face off and I'm also gonna turn my volume off so it doesn't look like I'm staring down at you, okay? We do have class. You need to come back at 7:20, all right? Which means you're gonna sign off of your phones out and you must be signed back in before 7:20 so you don't get
Alexa,
any attendance.
set an alarm for 7:20.
Sign out at 7:20.
7:20 Eastern time. Okay, it's 6 o'clock now, so that's an hour and like 10, 15 minutes away. When you come back, make sure you're quiet in case somebody is testing to the end. There's always one person and we need to be respectful for everybody, okay? I will give you a, you did okay, or you're borderline, or you need to come see me to review your exam, okay? I can't give you a score yet, but I can give you those things, all right? I do not need to see that thing that says that you've uploaded your exam. Now, some students freak out when you can't get it uploaded immediately. Do not freak out. That exam's there. I've gotten it a week later before. So just be patient, take your time. You will get your exams downloaded. You will get your exam grades tomorrow afternoon about 3 o'clock after I do an item analysis with other professor. Okay? All right. First of all, everybody come off of mute. I'm going to put you on mute. Mona, I need your keyboard looking at me. I don't want to see your face. I want to see the keyboard also. Please. Angel, you're still on mute. Emily, Shannon, Ellen.
I'm mute.
I know, I will put you on mute. Shannon, you are already on mute. Please, mute everybody. Okay. So Mona, just give me your keyboard front and we can start. Down just a little bit. There. All right, we'll go with that. So take a deep breath, relax, read the questions carefully. Look what the question is asking for, okay? Remember, no talking while we're now in testing. Put it in the chat. Remember, there's more than one student here. Give me a moment. I'll give you everything you need. It just takes me time sometimes to look up things. I will see you at 7:20. Good luck. And here are your codes. Let me get the chat box up. All right. For tonight's class, it is number 8, little w, capital S, capital L, capital D as in dog, capital K like kite. Again, number 8, little w, capital S, capital L, capital D, capital K. April, this is yours. 9, capital H, capital G, number 4, little d, little v is in the chat box for another look at it. If you have an access code needed, just give me the number and I'll take care of you. I am going on silent. You may start your exams. Go, and I'll see you later. Good luck, guys. Remember to sign in on your computers on your Zoom. Okay, once you're done with the exams, go off your phones and go back on your computers. So what did you think about the exam?
I feel like I did pretty good. I feel like it was fair. It was just to select all it applies that like literally everything that was in the PowerPoints and everything that was on the worksheet was on there, but it was just to select all apply that I feel like I either put one on there extra that wasn't supposed to be on there, or
You
I
didn't
did
add one,
one on there that was
yes.
supposed to be on there, but I put the right ones on there. You get what I'm
Mhm.
saying?
I know what you're saying. I know, they're very
But as far
difficult.
as the math was super easy. It was like boom, boom. It was probably only one that you had to change your pounds to kilograms. But then as far as like definition wise, I feel like that was if you studied your definitions on what these things were, and if you study like the Ericksons and fruits and all of that, then you would know as far as like the ages and what it's supposed to be, because it literally tells you in the questions at age 10 or at age 8, or and you
Right.
just gotta go back and think what are they going to be doing in this age. So I feel like it was fair in that, but it was the select out apply. And I think it was fast select out apply that kind of hurt me, or not hurt me, but was kind of like back and forth a little bit.
Yeah, the reason why we're not giving any point for select all, it's either all or none, is because that's your NCLEX. The NCLEX is gonna be like that. So we try to
I
make you
thought it
think.
changed.
Hmm?
People were telling me at my campus that the NCLEX changed, and word was going around that we were supposed to get the partial credit. It didn't happen, but NCLEX changed and they give you partial credit now, is what I heard.
And that's what I
Well,
was told too by a teacher.
what I can do is, I haven't heard this. So if you're telling me that, I'll go to the source.
The campus said that they're not giving us partial credit.
I will go to, Dr. Brown, and I'll ask her what she's heard. What are they doing with it? Okay, because we try to test you just like your NCLEX so that you get prepared and ready for it. So I will find out and I'll let y'all know. Okay.
What about some of those questions seem like they was kind of repeating themselves a little bit, like
They do. They ask you in a different way.
So I felt like I was picking the same answer for,
You could,
okay.
you absolutely, you could. So, and you didn't do that bad, so obviously you did the right thing.
It was a few
Okay.
questions on there too. I felt like I answered, and it could have been the right answer too as well. It's probably like 2 or 3 of those on there like that.
Jeffrey, we can go through all the exam and we can look at it. I want to know where your mind is because I can help you think. It's not a problem. Okay. Because remember, you're towards the end of the program now, and they want you to think more. It's not just memorizing information, it's taking it and using it now. So it gets a little more complicated. So if I can help you think, I will do that. And I could tell by your answers, I can get you to where you should think it. Okay. I'm really good at those sort of things. I'm an extremely good critical thinker. I can figure it out. If there's a way out of it, I'll figure it out. So I'll help you. Okay. Not a
Yes,
problem
sir.
at all. So, but all in all, this class did not do that bad on the exam. So take a deep breath, everybody. Number 1 is done. Now, while I was during the exam, I realized that you have an exam coming up. So I will be sending out review dates for next week, and I'll be sending out your review tomorrow. I'm going over the PowerPoint, making sure it's okay. Because remember, I'm new to teaching PN, and I want to make sure you got the information you need. Okay, I really make sure those concepts are there so that you can look at them and figure them out. Okay, so that's what I was doing during your exam. I was trying to get that ready, but it won't be till this weekend. I need time to sit, look at it, make sure I've done it right for you. Was Tuesday at 5 o'clock a good time for everybody for me to do another review? Because I will do it the same time. I know that some of the other class and this class both came, so I was going to just do it at the same time. Let me see, next week. Oh, I've got an infusion next Tuesday. So I'm going to do it maybe Wednesday. Is Wednesday better than Tuesday, or is Thursday? You tell me. I know that Professor Brunel likes to do it on Saturdays, and I know some of you work on Saturdays. So I like to pick a different time. Is it better evening or is it better afternoon?
Are you talking about tomorrow, Saturday?
No, I'm talking about next week.
Okay.
Next week I'm doing
Tuesday
reviews.
Tuesday at 5 is fine.
What I'm saying is I have an infusion. I will not make it.
Okay.
Wednesday
Wednesday I
works for me.
class.
So Wednesday at 6. I'm good with that. All right,
Yeah.
we'll do that for you.
I can't come because I'm in clinicals.
Yeah, no,
Remember,
class
I
at 6.
post everything. So
Yeah, as
have
long
it
as you
there.
post it, it's fine. That's
Okay.
great.
All right, let's do a PowerPoint. Now, I did the Cahoots in the earlier class. I'm going to send you that recording so that you're going to have the Cahoots also. But this class, we're just going to do the PowerPoint. So you're going to have 2 recordings to look at. Remember to fast forward to the point where I start teaching, okay? Because the recording is the whole way and I can't stop and start it because the whole way shows the attendance. So let's go ahead. Week 4. Now, I do go over these PowerPoints and I look at them and I look at quizzes, I look at exams, and and your HESI, and I make sure this is loaded with your information. So your PowerPoints are a really good way also to study, not just the review, okay? These PowerPoints are loaded with information. So this is all about the hospital, the kid in the hospital, how do they feel, parents feel, et cetera, et cetera. Now, when we go get care, it doesn't mean we're just going to go to a hospital, right? There's all different sort of things. We have outpatient, urgent cares, doctors' offices, home. We do some things also. And then we do have these extended long-term facilities You think of nursing homes for older people, but what about that child who has to have very extensive physical therapy due to, let's say, a broken leg, broken hip, broken something, and they need inpatient treatment? They would use those sort of facilities too. So don't keep that out of your mind, because children do go to those things. So preparing for a treatment. Now, we've always said, get on the level of the child, right? Always get on their developmental level, let them touch those things, be aware of them, but get the parents involved too. Now, what I see is infants, as we are teaching the parent, we're actually very softly speaking to the child, the infant, and we're teaching the parent what we're doing, why we're doing, so now they can be an active part of helping me. Because in hospitals today, you have a lot of patients. If you work in some sort of urgent care or ER, patients are in and out, and you need those eyes and ears of those parents to be able to help you to get better care. Plus, you're teaching the parents to take care of the child once they go home. We know that having familiar objects, their blanket, their sippy cup, their stuffed animal, whatever it is, make sure they have it, because that leads to a lot of comfort for them. Now, toddlers in preschool. I think that toddlers are one of the most difficult children to get ready and to have in a hospital. They love routine, they don't like differences, and they get very frustrated, especially if mom has to go home or has to go to work or has to take care of another child, because they're not there all the time. So if when the parents are there, because we know that there's other responsibilities, and 24 hours a day is not always what they can do, but involve the parents. Very simply explain things. It doesn't have to be these big terms. Very simply explain stuff to them. Now, when you're doing it, don't overwhelm them with a lot of information. Go very slow. And it's very, just ease into whatever treatment and then have them repeat it. So you're literally doing discharge teaching during admission and during hospitalization. Now, toddlers and preschoolers get very scared with us nurses. So use distraction. And what is a distraction? Well, it could be that blankie or that teddy bear that they like, or it's music, or it's stickers, or it's something that keeps their mind away from what we're doing to them. And it works good. I mean, if a child is in pain, if you give a distraction of some sort, they're forgetting that they hurt, right? And remember, kids like hugs, they like praises. Do those things, because it does make a difference, because now you're not the bad guy, right? They gave me a hug when I was done, or told me I did a good job. They want to hear that. Now, school-age children really are good. This is an age where children really love to learn. You can do a lot of teaching to these children. Again, you're going to let them on their developmental level, because remember, school age is age 6 to 12. It's a broad spectrum of ages. So depending on their age, on their level, developmental level, let them touch and feel the equipment. I let them push the buttons. I let them tell me the numbers and whatever, so that they're involved. They feel they've done something. And then there's always a reward. It could be a sticker. It could be a popsicle, because they've done everything you said. I mean, little things make big differences in the school age children. Now, adolescents always look like they're like, don't want to be bothered. I am an adolescent. I know everything, but they're scared, especially if something has to be done to them. So tell them what you're doing and have them help you. When they understand what you're doing and they're involved, they're going to open up more. And teaching the adolescent We'll make sure that they're going to be more consistent. They're going to do what they're supposed to do with the treatment or meds or whatever. Now, one of the big things with hospitalization, I've sort of mentioned it, is that separation, because parents can't always stay there. I mean, most parents work, then you have single parents, and then you have other kids at home, and some parents don't have a backup system. They don't have grandma, they don't have aunts, uncles. So all it is them taking care of the family. So toddlers, as I said, biggest problem is separation from parents. That's their biggest fear. They want mommy, they're going to be yelling, mommy, they're going to be screaming, they're going to be yelling. And this is the first stage of separation anxiety. Okay, so if you walk into a room with a toddler and they're yelling, mommy, mommy, screaming, crying, this is the first stage. But eventually that crying out and that crying is going to stop. And then we go into despair. Now, despair is when they go in the corner and they tend to forget about everybody around. They withdraw, they regress, they look sad, they look depressed. They might start sucking their thumb again. They might become incontinent. Where they've been potty trained. They're not going to want to play with toys. They're just there. They're in despair. They're angry that mom's not there. They don't know how to deal with it. And that's the way that you'll see them. Now, denial is mom and dad come and they don't pay them attention. And they're going to be in the corner playing with their toys. And mom's going to say, well, they don't even want me here. They're in the corner. They don't even listen to me. Well, we need to tell them it's a part of this separation anxiety, but your child does need you here and you do need to stay here. I mean, this is how they deal with this separation, because remember, these toddlers especially, I mean, it's all about me, mine, and I want my mommy here. And when she's not, well, now I don't want you. I'm going to play with my toys. It's the only way they can deal with it emotionally. That's how they deal with the stress. Now, how do kids act to hospitalization? Well, many kids, just become scared if they're old enough to understand. Because remember, age is important. Now, preparation, how should we prepare a child? Well, many kids need to go in, have surgery. It's not uncommon. Tubes in the ears, tonsils, adenoids, most common of all the surgeries on children. Now, when should you tell them about this upcoming surgery? As soon as you know? No. About 4 days prior to hospitalization, before this surgery or procedure or examination, is when you should start telling them about it. You shouldn't wait to the last moment, and it shouldn't be too long of a time, because these kids now are going to get very scared. But the 4 days gives them that opportunity to ask the questions that they do need. Now, some kids, if they've been in and out of the hospital a lot, let's say a sickle cell child, this child keeps going in because they're in crisis and pain. And these kids might have had a bad experience. These kids might act more violently towards hospitalization than a kid who's never been there before. So we need to understand, just because a kid looks like he's okay with this, it's a nurse's responsibility to make sure that we're teaching them, that we're holding their hand, we're praising them, and we're rewarding them for good behavior. Because remember, what do children think at this age? When you talk preschoolers, you're talking toddlers, what do they think about? Well, if I have surgery and they open my tummy, my insides are going to fall out. I'm going to bleed to death and I'm going to die, right? This is the way they think. This is why it's the age of Band-Aids. These children also believe that it was because they hit their brother or they were mean to their sister because God is punishing them. This is their beliefs, okay? And as nurses, if we understand that, we can help them deal with all this fear and stress they're going through. It's that separation from parents, like I said, the stressor. Pain, okay, hospitals are going to give you pain somehow. There's a needle out there somewhere that's coming to get me. And this is what children think. And then, of course, that fear of body intrusion. They're going to cut me open to take that appendix out, and my insides are coming out, and I'm going to bleed to death. These are real fears of these children's. So you need to tell children if it's going to hurt, even if they've gotten medicine, okay? Because if you don't tell them, there goes your trust. And now that child's fear is going to go way up because you didn't tell them it's going to hurt. Remember, sometimes they've got to cut the hair off the head with surgeries or do things, and now they don't feel good about themselves. Plus, they're not in control anymore. Sometimes you've got a condition where they can't get out of bed. What if it's a fractured femur and they're there on some buck's traction in the hospital, which means their bone is being pulled with this skin traction. They can't get out of bed, okay? They have to stay there. Kids don't like to sit, do they? They like to be up and out and around and checking everything out and seeing the stuff and touch, touch, touch. That's just what they like to do. So in a hospital, one of the things that we can do to alleviate fears is number one, all of that explanation, being truthful and honest, okay? And keeping them on a routine. Sometimes if they're going to be a longer time, we'll put up a board and we'll tell them the hours of the day and what's going to happen, especially if it's an involved care that we're doing for that child. So those rituals, routines need to be there. If they can eat normally, well, what do they eat at home that they like? You need to put those things into the diet or that favorite drink or whatever. So now they don't feel like we're like completely different. Like this is outer space. I want to go home. So as I said, regression is part of what happens in the hospital. You know, they in and out the parents because they have to work. It's just a part of life. So what do you see? You know, regression is telling you, I'm scared. I'm stressed. I don't know how to verbalize. I mean, can a 2-year-old tell you why they're upset, why they're stressed, and why they're depressed, and why they want their mommy? No, they're going to show you. And it's like here, if they want a bottle because they've been in with a cup, they're trying to regress, right? They're going backwards. They're trying to self-soothe. Remember, oral is always self-soothing, right? Again, they could be incontinent when they're potty trained, you know, and maybe they're on crutches, you know, older kids, and now they don't want to do that. Well, they want attention. They want you to baby them. That's the regression part of it. So regression is a sign of being stressed. It should never be punished. Okay, you need to understand that young kids in a hospital, all of this going on, mom and dad can't be there all the time. We keep walking in and sticking blood pressure cuffs and thermometers and maybe drawing labs. They're stressed, they're angry, they're scared, okay? So making sure, again, we make it more of a fun time for that kid. You know, letting them get stickers and have crayons and watch TV and cartoons, and maybe there's a PlayStation and we can give them some games to play or whatever. These things help the child deal with hospitalization. So why do we want to stop them from regressing? Well, we want them to get better. We need that good mental attitude. So if we get them out of being, you know, that regression or, you know, trying to be more babied, and we get them to be their age, now they're going to get better quicker because now they're going to help you help themselves, because we're going to be teaching even the young kids. Toddlers can be taught on their level. In their level of understanding, they can help you. They're actually really good, and they take it to the letter of what you tell them. So make sure at all possible to not punish them for regression, but do those things to get them out of the regression so they can be, getting better now. Now, pain. Pain is whatever they say it is. You see adults sitting there smiling, laughing, giggling. Yeah, I'm 10 out of 10. You're like, yeah, okay. Well, the law is any age now. Pain is whatever the experiencing person says it is. It exists when and where that person says it is. So that is the definition. Now, children, because of not liking medicines or liking needles, they might be there suffering and not tell you because they don't want to drink the medicine or get a shot. So sometimes it's just looking at that child. If you saw a child looking like that, stiff, all grimace face, look like they're about to cry, that kid's in pain. So you need to ask them, okay? Because that's probably the only time they'll tell you. Now, there are different pain scales. There's a FLAC scale, which is infants and nonverbal, and it's what the face looks like if their legs are either stiff, not moving, or like really fidgety because it hurts. And then it's their activity, they still are moving. And then crying and consolability, FLACC, and it works great. Now, a preschooler, when you get to age 3, you can use faces. And it's just like the numeric scale. And it shows faces from 0 to 10. 0 is a happy face, and 10 is this big, sad face with tears. Which one feels like you feel now? And a 3-year-old will point to the picture. And it breaks your heart when you see them go up to 8, because if they're saying it's 8, it's really an 8. They really do show you what they do. Also remember, pain, sometimes it's the position they're in, maybe they're hungry, there's other stuff going on with it. So don't just think it's that surgical pain, other stuff could be happening. And know that sometimes you walk in the door and maybe they're just afraid of you. Maybe they're just scared. So try to get that kid to understand that you're not there to hurt them, and be honest again, as I said. Now, this is your FLAC scale, okay? And you can see it, faces, legs, activity, cry, consolability, and you get a number and you add them up from 0 to 10, just like the numeric scale, right? Just like the faces scale, and it does work well. We use this also on children who cannot talk. You'll see this a lot with cerebral palsy. You can have an 18-year-old child who can't talk, but you can look at FLAC and you can find out where their pain scale. And this is your good old smiles, as I said, 0 to faces, and the kids will point to it. Now, how do we manage pain? Well, we all know there's medicine. You can give all the medicine you want. That's part of it. But remember that it's not just giving medicine that helps pain. It could be, let's distract them, right? Give them crayons, coloring, stickers, music, TV, something. It distracts them from it. Remember, it could be a hot pack, cold pack. It could be elevating the head of the bed. It could be getting them out of bed. Remember, it's sometimes the little things that help with it. And we also know that giving a child who's in pain, let's say they're post appendix, we know they're in pain, or a child that has a fractured femur, they have pain. If you give low dose pain medicines around the clock, you're really managing that pain well. And that kid, will tolerate hospitalization better. So when we look at giving medicines to especially younger children, remember their body systems are immature. Just like the elderly is just like the pediatrics. Remember, we take medicine in and it gets metabolized through the liver and excreted through the kidneys, right? Well, remember, the liver and the kidneys are still immature in many of the aged children. So be very careful with the doses that we're giving and always look for toxic side effects because some children are not going to excrete that medicine as quick as they should. So be aware of that as we're giving medications to children. So again, as I said here, most effective pain relief is those lower dosages of analgesics around the clock. It is called preventative pain control. That kid, you know he has pain. No, don't wait for him to ask because sometimes it gets so bad. We know we need to medicate before it's that bad, right? Kids won't tell you only because they're afraid. They're afraid of getting that shot, right? It's afraid of somebody hurting me. So if we're giving them a pain control, they're able to be up, around, they're able to eat if they can, drink if they can, you know, and it's not going to be just stuck in a hospital bed, can't move because I hurt so bad. Tylenol, very common. And you know something, Tylenol works very well. It's just not for fever. It also can be used for pain. And many times I'll use the ibuprofen, the NSAID, and Tylenol in between narcotics, and it works really well. It does really help it. Opioids, remember, these are strong medicines. These are used, let's say that fractured femur. Yeah, I mean, that has muscle spasms. You know, you've got those bones sticking in the muscles of the leg, it's swollen, it hurts, and you're going to get that morphine, the opioid. Now, fentanyl is something that most people don't hear about what it is. We get it from premature infants all the way up to adults. Why do we like fentanyl? Well, number one, it's extremely strong. It's the strongest analgesic. You know, it's stronger than morphine, stronger than hydromorphine or Dilaudid. It's fentanyl. What is good about it? It works really quick and it goes away within 1 to 2 hours. So it's really well controlled, okay? Now, if we're ever given opioids, we need to know naloxone is the antidote. Let's say you didn't realize the kid, you gave the medicine and now he's barely breathing and you need to wake him up a little bit. The doctor might order naloxone and it just reverses the narcotic. Remember though, that will wear off and you still got to watch that child. It doesn't take the medicine away. It stops it for a little bit, but remember, it still could come back and cause that respiratory depression. You know, today we're using a lot of pain-free stuff. One of the things we do, and it's not an adult world, it's the children world, is using some sort of lidocaine spray, jelly, cream for IV starts or for doing lumbar punctures or doing invasive sticks into the body. Or we even use it sometimes for IM and for immunizations because kids really are scared of it. And the one that we use a lot is called EMLA. And it's a mixture of lidocaine and prilocaine. It's this little white gel, works really good. And you put it on, wait there 20 minutes, and the kid feels touch, but does not feel pain at all. So we're using this a lot now. Conscious sedation. You know, we need to do a procedure, but we don't want the kid to be awake. A lot of times they use that in the dentist office, even for children when they have to do a lot of teeth or whatnot. What it is, it could be just taking it and smelling it in that nitrous oxide type stuff, or it could be this little white liquid. It's called propofol. And what that does, it maintains the airway, okay? You don't need to be intubated. You still breathe. You're still a little alert, but not really. You don't remember what went on. You do the procedure and you wake up very, very quickly. When you do conscious sedation, I've done it a few times working in the ER for doing really bad fracture sets, usually bilateral radial or ulnar fractures of the wrist that need to really be placed. And they'll do conscious sedation. And the kid all of a sudden is gone. And all of a sudden they wake up. And all of a sudden the cast is on the arm and they don't remember a thing. And it works well. and it prevents them from going to the OR, which is a huge expense and it's usually overnight. Now, a lot of times, I came to Miami and I was from a little neighborhood that there was no other languages but English. And I came to Miami and all of a sudden there's a bunch of Spanish speaking patients and I didn't know a word. Well, I've learned since I studied it closely. Plus my children's father was Cuban. So I sort of learned, because being around him. But you should never, ever ask a family member to interpret for you. There are these little blue phones. You pick up one side, the family takes the other side, and they will translate word to word. And this is your best interpretation of what that parent's saying. A family will put in their feelings of what that person said. You want only what they're saying. Now, when we're talking about culture, there are some cultures that you can't look at, you can't smile at, you can't touch. You need to talk to the father, but you can't look at the eyes. You have to talk to the mother. There's all different cultures out there. And there's some cultures that mom and dad know you're going to talk to grandma. That's usually the person. That's Hispanic that I have seen quite a bit. Because you better talk to me and not my daughter when it talks to my grandson. No, I'm actually teasing. I give her full whatever. But remember, when you're talking to a culture you don't understand, ask them, how do you want me to address you? Sometimes, I don't touch, I don't look. I'll just say, how do you want me to address you? Or do I who is the person am I going to be talking to? And when you start asking questions about, what do they need or want, or it's not a good touch, etc., they will appreciate you more because you respected them enough to ask. So you'll never have a bad thing that will happen because you asked. They really will give you kudos for being so observant to say, okay, how do you want me to address you? And then they will talk to you. So as you get accustomed, you'll know what to do. But initially, find out. So keeping personal space, right? Don't touch, don't go in that area. Some cultures don't like smiles. As I said, some don't like you to look at them. Some of them you better not touch or try to hug, okay? And remember, some of them cultures are that you need to deal with what's going on with the kid and how does it impact their family. Now, parents, we're sitting here taking care of children, but something, the kid isn't the only person we're taking care of. We have a family, and it could be mom and dad, but it also could be grandma, grandpa, aunt, uncle, and the best friends of mom and dad and the kid, whoever. You might see a whole group of family here. So remember, family's scared. They don't know what to do, and you need to communicate as best you can. Now, what we're doing today with parents and being with children has changed so much in the last 30 years. It used to be children, when they went to the OR, you couldn't even go into the waiting area before they went into the OR. Today, many parents go directly into the OR until they're asleep, especially if that child needs you to be there. So changing like that is done. Parents are also left to be with children during procedures, starting IVs. Most of the time, they won't let you like in a sterile procedure. Sometimes, depending on the child, even then. So parents, we need to remember them, and we need to know that parents take care of their kids and they want to be next to their child. Many times the parent keeps that child calm so you can do what you need to do. So nurses, we're going to be the philosophers. We're going to be, the people that go in there interpreting between mom and dad and grandma and the kid. And there's just so much that nurses do in pediatrics. You're the counselor for the group, the family group. So remember, and it's difficult sometimes. Sometimes you leave the hospital, you're emotionally drained because of what you had to give those parents. But you know, something is a good feeling because in the end, if the child's got what they needed and the parents feel good, then you've done your job. I mean, I've had children and I've had parents totally involved, talked with them, let them do everything, and be involved with it. And sometimes these children don't make it, and they die. But you know something? Years later, the parents come to me and thank me for letting them partake in the care of their child. So you as nurses can be a lot to a child and to the family. Okay. Now, when you're talking about stuff with the child, remember, get on their level. And sometimes you don't need, like this says here, you don't have to go in depth. Give them just enough information to understand what you're doing because too much information will scare them too much. As I said, it can be very frustrating to meet the needs of this child, especially when there also is a mother involved with it. Sometimes children are scared because the parents aren't there all the time, so they miss those hugs. Their schedules are thrown out the window, right? So we try to put them as much a schedule as we can. And, one of the things, especially in those young infants where the infant was, taken away and immediately brought to the newborn ICU or PD ICU, make sure that we do that parent-child attachment. Sometimes they don't get it. I have many a times had a child in the newborn intensive care and the mom comes in the first time and is looking there scared to death. I'll make them sit down. I will wrap the child in a blanket, put it in their arms, and I'm like, oh my God, look at those cheeks. I just want to pinch him. Could you kiss those cheeks for me? And you know something? It helps that parent stop being so scared and then gets them to be an active participant of the care, okay? One of the things with kids, we do need to be consistent with the caregivers. We can't have a new nurse every day if not possible. That throws their schedules off too. So adjusting to an illness. Now, number one, they sort of have to understand what's going on with them. Sometimes all of a sudden they're diabetic. Sometimes all of a sudden they find out something else is going on. Remember, they need to be part of the teaching process. As they get older, we know like adolescents, they have to be a part of it because they're the one who's going to be taking care of themselves. And we need to let them think and we need to allow them, to ask you all sorts of questions, okay? Because they can make decisions for themselves. At the adolescent age, it's not all mom and dad. Remember, they're going to do what they want anyway, because that's what adolescents are. But make sure that you teach that adolescent, they know what's going on, and as you get going with an adolescent, you're going to gain their confidence and, they're going to be able to take care of themselves even better. Adolescents, putting them in a room with another kid who is screaming and yelling and younger or in pain, and they're a kid who came in for something like the codes question I had today. They came in with cystic fibrosis. What room do you put them in? What is a good person to put them with? Well, I ended up putting them with another adolescent who had diabetes because they are both non-infectious diseases where they have to take care of themselves. They were close to age and it was a perfect choice. So always remember roommate selection. Adolescents like adolescents. They don't want to be with a younger kid. Like, why they put me with this kid for? Remember the confidentiality, legality, remember consent, remember 18-year-olds. 18-year-olds can sign their own consent if they're cognitively awake, alert, oriented. Remember to respect that and ask parents to have the child tell them what's going on or give permission for it. So always be aware of who can sign consents, who can't, and who you may speak to. I don't like doing stuff over the phone because I don't know who it is, right? unless I've given like a passcode number to the adolescent who can call in, let's say, adolescent calling in for results at a doctor's office. Those things can help prevent, those wrong people getting the information. Discharge planning starts from the moment they enter the hospital, right? Because what are we doing? We're teaching them as they go along. And we know we're going to teach that child as much as possible to do it for themselves, right? We want to make sure they can do it right. So we're doing a demonstration. We talk to them, then we do the demonstration, and then we do it together, and then they do it by themselves. So this makes sure they're doing things correctly. So discharge planning, we know it starts from the beginning, and we know that there are certain things that we might see with behaviors, especially after they go home. Now, we know that sometimes kids go home and have nightmares because what do we do as nurses? We wake them up all night, right? Take vital signs, check their dressings, whatever. So they get these nightmares that go on. Kids might be more clingy, more huggy. That's why we need to allow these families to come in to see them as soon as possible. We always, as we're taking care of them, not focus on how bad that wound that's draining that we're doing dressing changes on. Praise that, wow, you knew that there was gauze coming next. Oh, you knew that you were going to use this tape instead of that tape. Praise. Little things like that, you can do it. As I said, trust, be truthful, do not lie. And then, of course, give them something to play, do that distraction, and give them time to be kids. Because in a hospital, what are we doing? We're doing a lot of, sometimes painful, scary procedures. Always listen to what they're telling you, because they are going to say the craziest things about illnesses. So make sure that we do take care of those misconceptions and let them know the truths about stuff. Again, separation anxiety is going to be there. And also, we always will allow that child to come and visit before we go into hospitals too, and it does help. Discharge charting, always remember what to chart. We're going to have time of discharge. We're going to be who was there. Was it mom or dad? Make sure you send them home properly. Did they go home in a car, taxi, what? Vital signs, weight, medications, instructions, and did they understand those instructions? Very important, because now you've covered yourself when the parents say, I didn't get any discharge instructions. Well, there it is. I wrote it down. Home care, not uncommon. Today people, adults and kids, they don't stay in the hospital for the whole length of treatment. They get to a certain point and then they send them home with home health. Make sure that they get the proper people in there to take care of them and to make sure that they get the proper care to complete the treatment that they need, okay? We know the school system also has to make sure that kid gets schoolwork, whether they send out a teacher or just send the homework, whatever it is, make sure the kid gets all their needs met, and school-age children need their homework. Any questions? We made it just on time, didn't we? Any questions about anything? Remember, I'll be posting the grades tomorrow by 3 o'clock. Remember, I'm going to look over those exams to make sure every question was a good question. That if I see a lot of students missing it, I'm going to look at why. And if I see those things, me and Professor Brunel will throw them out, okay? So know that I have your best interest at hand and that I will make sure that it is a fair exam. So I wish you a happy weekend. I'll be sending out that review and the review times. I'll be sending that out by Sunday for sure. If anybody wants to meet with me, please just send me a message and I'll be more than glad to do that. Questions? Good night, everybody. It was a good
Good night,
night.
Ms. Bogart.
Thank you.
My pleasure.
Am I staying on, Professor Bogart?
Yes.